This meeting is being recorded.
I remembered this week. So hello, welcome everybody to the COVID Community Champions meeting this Wednesday, the 23rd of November. As usual, we're recording the meeting so people can listen to it back afterwards. If you're shy, you can put things in the chat and we'll find them from there. You can always email us at our usual address at ccc@wakefield.gov.uk. So here's the agenda. We've got Steve Turnbull giving us a quick update on where we are with COVID. Emma's going to tell us about winter warmth, followed by Ben with warm homes. Sarah Ackers from the NHS will be telling us a bit about vaccinations. We've got a lovely little project we'd like to share with you about Dolly Parton's library. If you haven't heard of it, Emma's going to tell you about that, and then some few other things before we finish. So straight on to Steve Turnbull, please.
Okay, thanks Tracy. So I won't take too long, hopefully. So I've got these slides to go through and then a couple of other things to mention around some more recent research on COVID. So if you flick to the next slide, please. We've been through this before several times, but we know that that the data isn't as good as it used to be. So yeah, if we just move on to the next one, please, Tracy. So these are three main measures that we follow. The one on the left is really the most important one, which is the kind of case rate, and you'll see that you can still see that how this kind of spiked back in September, early October time. We normally see a rise in respiratory infections that time of year. The colder weather starts, kids go back to school, many more people circulating around. So we always see an increase. We've seen that for COVID as well as other infections, but it started at a higher level than previous. But we've come down quite well from that. I won't dwell on the other two charts, but you can see on all of them that the Wakefield average, which is the blue line, is fairly much in keeping with West Yorkshire and England average. So if we move on to the next one, please. And again, this is the classic epidemic curve, so confirmed cases in Wakefield from August this year. So you can see that curve that I mentioned, that uptick in cases, and then the key message is we've come down quite well. We're seeing this across the country as well, actually. So Yorkshire and Humber is down to something around 2% of people may have COVID at any one time. That's a fairly consistent pattern. Most areas of the country have seen this increase and then have come down well. We do, however, expect at some point, hard to say exactly when and how high it will rise, but we probably will get another rise at some point during the winter months. Next slide, please. Yeah, I mentioned that, so you can see this is ordered left to right on those little charts from the highest to the lowest. So Yorkshire is the third highest, but pretty much everywhere has got a similar kind of pattern at the minute. So somewhere between 1.5% and 2% of people would be positive. This was a few weeks ago, so data is always delayed, and we've not had an update since these figures were done. So, but we expect to be, if anything, probably a bit better than that, but not much different. It'd be interesting to see whether people are feel that rates have come down, or do we still all know a lot of people who have reporting COVID symptoms? But that's insight from the community, because our testing isn't as rigorous as it was. We don't test as many people, so hearing anything back from champions would be really important in understanding where we are locally. Next slide, please. And then by age ranges, this is across the country, not specific to Wakefield or even Yorkshire and Humber. And again, it's a fairly similar pattern. We know that the cases in children went up rapidly because of them going back to school. They've come down even more than the rest of us. Now we're following suit. So again, some really positive declines in the 50 plus and 70 plus age groups, which is good to see. Next slide, please. That doesn't tell us a lot, so we'll move on from that. You may remember that used to have a lot more colours on that, and this is the whole picture of the pandemic, really, but viewed through hospital admission. So this is patients with COVID in mid-Yorkshire beds. and the dark blue bars are the Wakefield residents, and now obviously we have Mid Yorkshire Hospital serves more than just Wakefield, so you'll see the total number with the other lighter coloured bars. And again, you can see what we always see. We always see cases go up, then admissions go up, and when cases go down, they're followed by admissions coming down. So an improving picture within the hospitals as well, which is all good to see, because we are still obviously worried about winter, not just COVID circulating, but potential for flu circulating as well. I'm sure Sarah will mention it when we get on to vaccinations, but it's COVID vaccinations and flu vaccinations that are really important at this point. So if we move on, please, Tracy. And then, of course, what we always see, we see cases increase, we see admissions increase, but we also then see death numbers increase, far less than we've seen in previous waves. You can see the kind of scale that we were dealing with before. We're not in that ballpark, but it's important to note we still do have small numbers of deaths by COVID locally and across the country. So nationally, mortality rates for COVID increased to 31 deaths per 100,000 people in October, and that was up from about half of that in the previous month. So you can see that this still does have an impact on people's mortality. And in 2021, COVID was the second highest cause of death for people, for care home residents, second only to dementia and Alzheimer's. And amongst the general population in 2021, it was the second highest cause of death as well. So this is not, whilst we're in a much better place, it still does have the potential to make people really poorly and bring their life to an end earlier than would otherwise happen. So and that's important that we don't forget that. If we move on to the next slide, please. Before we go on to any questions, I will just mention some other things that are being found out. We're still learning a lot about COVID and analysing lots of data at national level. But there was some research that was reported last week, 5 days ago, that looked at COVID risk of death for people with sensory impairments. And what we found, what was found nationally, was over the big 3 waves of COVID that we've had, then people with sensory impairments had a worse experience of COVID, and their death rates were higher. And there's no simple explanation for that. It could be a number of different things. It may have other pre-existing conditions which may have affected it. Maybe that they had fewer vaccinations, which we can again, that's a challenging issue, or maybe that they need more time in healthcare settings as well. So maybe more exposure to potential infection. But even looking at all of those kind of explainers, the fact still remains that people with sensory impairments, either whether that's age or eyesight, hearing, or both, have higher levels of death from COVID. So it pushes another question for us: how are we doing the right kind of communication to some of those groups? So again, that's something that we'll be more than happy to talk through either here or at another discussion at a later date. That's the only other thing I wanted to mention, Tracy.
Thank you very much,
Steve.
And I think that's really important, because we're looking at getting our winter wellness messages translated into different languages. For example, some colleagues and myself are going on an easy read course to learn how to make documents into easy read. And I think it would be really useful for us to meet with Hayley from the Sight Aid and Val from the Deaf Society to see if we can do more and make more of our information more accessible more of the time. So thank you for that. Do we have any questions, please, for Steve on the data or anything else? I'm just trying to get into the chat to see if there's anything in there. Oh, Val's just put, that's great news. I didn't notice you were on the call, Val, but that's thank you. Yeah, we definitely need to get together to speak about that. So thank you very much, Steve. If you don't think of any other questions or any comments, please do send them in. winter wellness. So I'm just looking. This is Ben's bit next. I'm not quite sure what that slide's doing in there. And I must say to people, I've had a bit of a nightmare this morning with our G drive being down and some technical problems. But I think it's your next, Ben. Is this your slide?
Yeah, it looks like one of mine, to be fair. So we've got basically in terms of winter warmth, obviously one of the most effective ways of keeping people well and financially stable is through a variety of means around improving heating systems, providing insulation, and things like that. So what we've developed is called the Healthy Housing Pathway, which is basically a catch-all front for a range of council services that can assist in residents in a variety of ways. Tracy, I think this is one of those irritating ones where you have to keep clicking. So there we go. Yeah. So it's for people who are obviously experiencing or at risk of fuel poverty, facing high heating costs, or have poor energy efficient homes, people whose heating or hot water systems are broken, particularly in the winter. Obviously that can be devastating if they can't afford to, if the boiler packs in and they haven't got, £2,000 to drop on a new boiler, then that can cause serious problems. Poor or hazardous housing conditions. So like we've seen with that sad case, where there's the boy over in Rochdale, weren't they, who house covered in damp, and sadly he passed away. So anything like that, we're inviting people to report in, and issues with private landlords who aren't maintaining the properties in the way that they should be, which is causing problems for the residents. So that's who we're sort of who it's for. So let's go to the next slide, please, Tracy. So as I mentioned, what it can provide is we look at providing loft and cavity wall insulation, energy efficient heating upgrades, so the heat pumps and solar panels are on a little bit of a hiatus at the moment. The funding we've transferred into just boilers at the moment, because that's by far and away the biggest cause. There's a lot of people in the district still with back boilers, or stuff that was put in the early 2000s that's really coming to the end of its useful life. Also, with the bills going up, we've got a Money Smart team who assist people to address and reduce energy debt and other sort of debt. They can look at someone's whole financial situation, go through it with them to maximise income and reduce outgoings, and they can also provide direct financial assistance to those who are struggling to keep the heating and light on. And then, as mentioned, we can compel landlords who aren't living up to their responsibilities to make the necessary repairs, and it's a bit of a carrot and stick approach, that as well. So we do support landlords to improve the properties if they don't have the means to do it themselves. If you go to the next slide, please, Tracy. In particular, we're asking professionals and neighbours and just people in general to keep an eye out for the following groups who may be struggling: families with children, yeah, there's a lion baby here, those who are aged over 60, and those in particular those with a condition or illness made worse by cold or poor housing conditions. So that can range from everything from asthma and your sort of respiratory illness, COPD and things like that, to arthritis, joint problems, cardiovascular. If someone's got mental health problems caused by stressing over debt and energy costs and things like that, we would consider them as priority referrals and that we're particularly interested in. So how to refer into this? So there is a number of ways, but the best way to do it is if you go to the Wakefield Council website. So it's www.wakefield.gov.uk/housing. You will see a link to the Healthy Housing page on there, and you can just click into there, and there's a big blue apply here button along with all the associated information that you might need to make a referral. Let's go to the next one, please. Yeah, and so on that, as yeah, in that area, in the housing area of the Wakefield Council website, put my teeth in. There's a whole range of information for people around keeping warm, saving energy tips, where they can get support for a range of things. I just thought I'd include this one because these are some of the top energy saving tips that people can do for free, that we're just wanting people to prompt. You know, if they remember, they're quite easy to remember. They seem quite obvious, but you know, a lot of people don't do them, and added together, they can add up to quite substantial savings. So, you know, I won't go through them all, but, you know, turning your washing machine down by 10 degrees, turning your thermostat down by a degree, you know, using your microwave and wearing extra layers inside instead of bobbing the heating up and things like that can make a big difference to people's expenditure. Let's go to the next one. Yeah, these are some useful winter contacts. So you've got obviously the more money in your pocket, which is another strand that's run by, is that WDH, I think. They assist with sort of financial help as well, because a lot of the financial advice, like our Money Smart service, is absolutely swamped at the minute. It's I think they're looking at about a 3 or 4 week callback at the moment. They're absolutely rammed, yeah, and they've had extra funding for staffing as well. So yeah, more money in your pocket there. Obviously, NHS 111. There's the help at the hub, so anyone who lives on they're typically around the estates and stuff like that, they can nip in there and get all sorts of support from Citizens Advice and other agencies who pop up there. And if you go on that link, it'll show you what services are there, and when they can attend stuff. The warm spaces, the link I've put there, that's a provisional list of the available of the warm spaces that are going to be available. We've got a meeting this afternoon to finalize the sort of finer points, the promotion and arrangements that are going to be for those, but the opening times and locations are already online at that address there.
And I understand, Ben, that you can get a warm cuppa and a biscuit while you're there as well.
Yeah, well, yeah, warm cuppa and a biscuit as standard, and we're trying to get. It's a bit of a difficult one because we're trying to get. We don't want it to be. We want people to be accessible, and we want them to be useful, but we don't want it to be somewhere where people think, oh, if I go there, then I'm going to get bombarded with all sorts of helpful people. You know, do you know what I mean? We want it to be well. Yeah, so we're trying to find that balance with them. These are the contact details for the referral pathway, and you can find out a bit more about active schemes we've got going and what have you. And I think the next one should be any questions.
Yeah. Sorry, Ben, you know the one right at the beginning, was that your slide as well? I seem to have got a slide in the wrong place there, didn't I?
No, I think that was a public health slide looking at it, but that was a link to the winter wellness website that Public Health have created, and that's got loads of useful information on it as well. So
that might have been Emma's slide, so we'll have to go back to that if I've got it wrong. But thank you very much, Ben. Does anyone have any questions or comments, please, for Ben?
I do.
Yeah.
Yeah, your contact methods are not always suitable for deaf people, and have you considered an option such as Sign Live, so deaf people can make contact through that provision?
No, I'll be honest, that's not something that I've that's not something that I've considered, in fairness, when setting this up. Yeah, I potentially should have done so. Yeah, I can look into that. What was that called again? The Sign?
Well, there's Sign Live and Sign Video. There's several out there, but they're the two main ones. And a deaf person would make contact through those rather than through Deaf Relay, which often providers think a deaf person can do that. Emails and so on may get lost in translation. Any replies might get lost in translation because a deaf person's English is, some of deaf people can have a reading age of 9. So it's best if they can make contact via video. It is their first language.
Yeah, no, I'm more than happy to. I'll look into that if it's something we can get set up. Yeah, more than happy to look at that and provide that facility if possible.
And Val, I'm sure that you won't mind me giving your contact details to Ben if he needs some help in setting that up.
No, not at all.
Excellent. Thank you very much. That's very kind of you. Do we have any more comments or questions for Ben, please? No? Well, thank you very much for that, Ben. If we do have any questions, we will either come back to them at the end or I'll email them over to you. But well done, actually, because I know that you've not been long with us in the council. You've been brought in to do this work and there's been a lot to do all at once. So well done, Ben.
Oh, thank you.
And there's Ben's details. I think I've shoved Sarah in the wrong place, but Sarah, would you mind coming in and doing your slides and we'll come back to Emma. Sorry, Emma, I think I've got a bit mixed up with the slides.
I don't mind at all.
Thank
Hopefully
you.
everyone can hear me. Hi, so last time we caught up, I think I started off by saying that we are halfway through our 15-week programme. So if I can pop into the next slide. We're now into the final month of our 15-week programme. And while the programme of vaccinations doesn't completely end, we do start to ramp down a little bit as we get into the middle of December. So it's useful to catch up now because we're on a push to get those last few doses. So this is how it's going at the moment for our seasonal booster programme. We've got well over 86% of people in care homes vaccinated, over 87% of those who are elderly or housebound. Lower uptake in our clinical risk patient group, it's around the mid 40%. Relatively good uptake in health and social care or in carers, but we'd like to see more. And only 50% of those who are 50 to 65 so far have come forward to be boosted, although we've only been offering vaccinations to that age group for the last 4 weeks. So the data here on the right hand side, the green bit is the people who've been boosted. Now that's actually gone up since I produced the slide earlier because the data has just been refreshed for this week's update. So we're about 105,000 people in Wakefield have now had their booster, which means that the numbers in those overdue or due now groups have fallen below 50,000, but that's still 50,000 people who could benefit from a dose this season if they're able to come forward in the next 4 or 5 weeks for us. So we'd certainly, if you're having any conversations with people who say, oh, you know, it's all going away, it still is an unpleasant illness, and we would still really encourage you to come forward and get your jab because it may, at the very least, shorten an illness for you this winter. Okay, so that's how we're going with this last month still to go. If I could have the next slide, please. So where are we still having some challenges? So this is the map which shows our coverage in Wakefield, and as you can see across Wakefield, we're a little bit more patchy, particularly around the southeast, because we only have GP services, GP surgeries offering vaccinations down in the South Emsall area. We do have lots of pop-ups down in that area being run by Queen Elizabeth Vaccination Centre, who otherwise operate out of the centre of Wakefield. We have managed to get 2 more pharmacies to join up, so we now have 12 running in Wakefield. So the 2 new ones are Trinity Medical Centre in Wakefield, who have been going for about a week now. They've been very popular. They've done about 100 vaccinations, you know, right in the heart of Wakefield. Very easy for people to pop down there if they're maybe going to the Morrisons in the ridings. It's just a short walk, and we also have a small community pharmacy in Castleford, which is the Well Pharmacy in Castleford Riverside, and they opened on Monday and immediately did 25 jabs, which is really good. So yeah, we are all the time trying to get more coverage from pharmacies, especially since that is a way for people to get their COVID and flu together in the majority of cases. Okay, so having said that, we've got about a month to run now. We're not resting on our laurels. We're having a big push, so through to mid-December. And mid-December, the reason that's an important date is that if somebody gets their jab by the Friday the 16th, then they would be covered for a party on New Year's Eve. So, it takes about 2 weeks for your immunity to develop from your jab. So, to focus minds, try and get your jab 2 weeks before you hope to be partying and not off sick. So the things that we've got in our big push this year are, we've got the Bagger Jab weekend coming up, and I think you're going to see a slide in a bit with what that comms campaign looks like. So this is a link between getting a jab along with your Christmas shopping or maybe your Black Friday shopping. And then there's another one coming up that sounds quite fun called the Santa School campaign. So that's going to be a push around vaccinations on the 2nd, 3rd, 4th of December, and then through to the end of the programme. And we have lots of capacity across Wakefield. We've got lots of places that you can book, lots of walk-ins, and we're also running pop-ups as well. So we'd really encourage people to come forward. Thank you.
Excellent. Thank you very much, Sarah. We do have a question or a comment in the chat from John, and I'll read it out. It says, looking at the patient information for those that have severe allergies to vaccines, the one suggests that you should not have the vaccine. Then if you do want to travel 1.5 hour journey to Airedale Hospital.
Yeah, so this is a question about a very specific group of patients who can't have the mRNA type vaccine, which is being offered as the booster this year. Normally, in almost all cases, it's because of an allergy to something in the vaccine called PEG, which is also in some other medical treatments, but unfortunately there are a number of people who are allergic to it. And unfortunately, it is the case that the NHS has made the decision for this season to only offer one site in each county, effectively, that is going to do that. So it does mean travelling to the vaccination centre in Airedale or one in Hull, if you're in West Yorkshire. Yeah, so that is actually correct. But John, if you want to get in contact outside the meeting, with any concerns, we'll obviously talk to you about that.
That's champion, thank you. Does anybody else have any questions or comments for Sarah? I can't see any, so I'll move on. And I'm really sorry, I'm going to have to scroll all the way back because I did make a serious error.
I could never have followed Dolly Parton, could
I? I'm sure there's a better way to get back than all this. Wait a minute. If I just stop sharing a minute and try and get back to the slide where we should have done. Here we are. I think this is the one. Winter wellness. Oh no. Oh, what a nuisance. Can anybody sing a song while they're waiting? There we go. Sorry about that, guys, but hopefully you can see now. Winter wellness. This is Emma.
Hiya, thank you, Tracy. Don't worry about it. It was just a reminder that we've got the Winter Wellness page where you can find information about how to keep warm and healthy this winter. We've created a booklet with more information. We're distributing that to GP surgeries, the warm spaces, the family hubs, etc. We're also in the process of translating these into different languages, and we're also going to be looking at how we can get that booklet out to visually impaired people and hearing impaired people as well. So we're in the progress of that. And then, as you know, we're focusing on a different topic each month. So this month we are focusing on keeping warm in your home during winter. And then if we can we go to the Imagination Library, please? Thank you.
Yeah, I'm just working through because the ones with Ben's were lots of little clicky bits, so I'm going to just find it for you now. There's always challenges with internet, aren't there? There we go. I think I'm on the right slide now for the Dolly Parton.
Yes, thank you. So this is a lovely scheme. The Imagination Library delivers free books to children in certain areas in the Wakefield district. It's an initiative that gives children a free high quality book from a range of different authors each month up until their 4th birthday. So if you know someone, if you know a child in Nottingley, Pontefract North and South, Castleford Central, Ferry Fryston or Airedale, and they're aged 0 to 2, you can register them into the scheme. So you can visit that web link from the Spectrum website. You can also visit Airedale, Castleford Central or Pontefract Library to register, or you can also call Spectrum on 01924 311 400. Yeah, it's a really good scheme, encouraging children to get reading with their families.
Thank you very much, Emma. And we know how important it is for young children, don't we, to be exposed to books in the home, even if they can't read yet, and play with books, and for it to be something that they become familiar with. And it really does help with their education, and obviously with the well-being later on in life.
Yeah, definitely.
And it's awesome that they're free for up to the 4th birthday. That's really good.
Yeah.
Thank you very much for sharing that, Emma.
Thank you.
And there's just a few more slides. I came across an article that said November was COPD Awareness Month, which I hadn't realised actually. And the information there said that the likelihood of developing, and it's chronic obstructive pulmonary disease, is more likely if you smoke and the longer that you have smoked. So the most important thing you can do is try to stop smoking if you can. So I thought it was a good time to just put the NHS information website there, and Yorkshire Smoke Free have got lots of information that they can share to help people if they want to. We know this time of year for respiratory, flu, COVID is, you know, likely to be on a rise. So if people want to stop smoking, there is help available. There's also a link here for vaccination in pregnancy. I don't know if Darsha would like to say a few words on that, because I'm not sure if you sent me that, Darsha, but if appropriate. There's a new resource, so there's a link there for the web page. We've also got an offer to all of you on the call, whether you're a COVID champion or whether you work for the council, or even if any of your wider network would like to be involved. We want to produce some easy read documents, and we've got some funding, thank you to Steve, to enable us to offer some training. So the idea is, if you've got a document that you'll use for your group, your community group, whatever, you would like it making into easy read, you can come along to a session. It's about 3.5 hours. There are only 5 people in the session, so you get lots of one-to-one support, and you turn that document into an easy read document. About 3 weeks later, you come back and the tutor looks at what you've done, and at the end of that 1.5 hour, you go away with a bespoke document that's been done for you. It's easy read and it's been checked and approved by an easy read person. So that training is free. It's 3.5 hours initially, followed by another 1.5. So if you'd like to find out more or come along to the training, please let me know. And then I think it was Pam Hodges, I'm not sure, but somebody on this call last month or at the last meeting asked if we could possibly have some thermometers, because some people found it difficult to remember what heat was the right heat to have to keep the homes warm. So Ben Oldham has organised some thermometers for us, and we've managed to blag a few. So if any of you would like a supply of them for your community centre or community group, please let me know how many of you'd like and where you'd like me to post them, and I'll do my best. And then that's the pop-up clinic picture that Sarah spoke about earlier. And I think that concludes our slides for this week. I'm looking, I don't think there are any more comments or questions in the chat, but does anybody have any more comments or questions they'd like to make before we finish? Can't see any. In that case, thank you very much to all of our speakers and every one of you for joining in the meeting today. We do have a meeting arranged for December. I think it's 20 something. It's very close to Christmas. So I'm hoping that some of you might be available to come and join us with that. That will be the last one of the year. So thank you very much, everybody, and hope to see you next time. Take care.
Thank you.